So in this episode, I interviewed Nick. Nick works in the space of healthcare startups, which is the exact same space that I work in. So I was super interested in interviewing him, hearing his story, because when you're a young guy in the space like me and you meet an older guy who's been in the space longer, you're always curious about what they went through, because that could be potentially what I could go through. You want to hear about his highs, his lows, and maybe that can give you some insight into your future. So enjoy the podcast with Nick. Hope you enjoy it. What's your story? How did you get to where you are today?
All right, yeah. I kind of just fell into healthcare. I went to college at FSU for applied economics. So I was actually initially looking for jobs doing like polling or working for like an investment bank or something, but I had an opportunity to work for a company out of Fort Lauderdale called Weatherby Healthcare, which was at the time, I think it was like a top 5 company to work for on the Forbes list and all that, and it was great. So I accepted a job there just doing staffing for surgeons. So urologists, ENTs, neurosurgeons, cardiothoracic surgeons, plastic surgeons. Did that for a while, kind of had a knack for it, I guess. And yeah, really enjoyed talking with surgeons and learning a lot about, healthcare and all the ins and outs and, just kind of how crazy the whole concept of surgery is and how amazing what they do is. So from there, I just kind of stayed in that same lane. From there, I went to a smaller firm for a little while, helped them build up their surgery division. Then I got approached to start a staffing company by a doctor just focusing on urology back in 2019. So made the leap of faith, did it. You know, uh, Worked there for about 4.5, 5 years. Built the company up to be highly successful. Unfortunately, that business partner turned out to be a little bit of a scumbag. So he basically forced me out with nothing, even though I had built the entire company myself. So that was a little rough. That was about a year and a half ago at this point. So had a little time off doing the job search thing, and then I ended up talking with this company, Virtue Care, that's owned by a urologist, and just fell in love with the business model and the company. It's very much a startup right now, but it's a very different approach to kind of solving the physician shortage issue that what I was doing before, which is called locums, which is basically just moving doctors around. It wasn't really a solution. It was just more of a, I don't know.
Logistics things.
Yeah. I mean, you're just paying people a bunch of money to work less. So ultimately, I don't even know that it helps, but it is a very lucrative industry, and I think 60 something percent of hospitals use locums in some form. So definitely still an important thing. But yeah, now I'm here. I'm the director of operations and sales here. So really just kind of doing a little bit of everything right now. Wearing a lot of hats, and I love it. That's you know, the startup and building has always been what I love more so than like having a well-defined job that you go into and you work 8 hours a day. That doesn't
And
excite
I
me.
think you and me are probably pretty similar. I mean, I was working at a casino, and my friend became CMO of a tech development studio. I started doing content. He offered me a position. I did some content, did some editing. And then over time, the entire concept just developed into, we're not doing tech anymore, we're doing health tech. And then I slowly graduated into more of a sales position, but at the same time, it is a startup. So, I also do podcast interviews and I do editing as well. And
Yeah.
even some success. I do some,
Yep.
background clinic success and making sure that people are satisfied with customer support. So I totally understand everything you're saying. Very curious about Virtue Care. Like, what is Virtue Care?
Yeah. So right now we're operating only within the specialty of urology, but how it basically works is we partner with typically rural hospitals, not always, but typically our typical client's going to be a rural hospital that has not had any sort of urology services in that community for decades, maybe ever. So we help them provide that. There's a few different kind of steps to it. The first step is we help them identify an NP or PA who's interested in learning urology. We then have a 12-week fellowship program that we put them through. Typically, it'll be like someone out of OB or emergency medicine or something wanting to upskill to urology. So we put them through a training program. It's 12 weeks. And then once they complete that, they're now a urology NP or urology PA. So they're going to then open a clinic there locally in the rural community, seeing patients, and we're going to support that NP or PA with a urologist remotely, just for any questions they have, anything that rises above their knowledge or comfort level. They're going to have a urologist there, anytime the clinic's open, that they can just pick up the phone and call. So that's how we kind of deliver the outpatient piece. And then the third piece of what we do is we identify urologists, typically locally, who are going to come in anywhere from 1 day a month to maybe 4 days a month and just perform surgeries. We stick to what's called general urology, which is kind of smaller, more low acuity cases, but within urology, that tends to make up about 95% of the caseload. So we, do all the proper workups for the patients. We get everything teed up. We have a surgeon come in however many days, knock out the cases, and then the follow-up care is going to be provided right there locally within that clinic. And then, again, if anything requires a higher level of care, like a prostatectomy or highly specialized cancer care, we'd be referring that out. But the overall goal is being able to keep urology care local because, America's huge. And there's a lot of places where right now, if you want to see a urologist, you have to drive 3 hours, take a day off work. You might not be able to get scheduled for 4 months down the road. Excuse me. So, for the communities, this is just, amazing. And the model's really been taken off to the point where we have hospitals calling us now, asking us to put the services in rather than us having to reach out to them. It's really taken off.
Which is a good sign. It's definitely a good sign. Yeah. So who are you, is your typical, I don't want to use the word customer, but like who would become a urologist? Like, are they like general practitioners becoming urologists, like dermatology?
So no, I mean, to be a urologist, that's a whole, you have to go through a residency and a fellowship.
A nurse practitioner.
Urology. Yeah. Yeah. I mean, it's a really comprehensive program that we have developed that's, we actually worked with a team of urologists and urology mid-levels to build everything out. And, it's 11 weeks of you're at home learning remotely through, we have videos and, different courses we've designed and quizzes and slides and all that. So you learn it, then there's assessments, and then the 12th week of training is actually you spend a week at one of our existing clinics just shadowing one of those NPPAs just to kind of get a feel for it and see it in person and all that. Yeah.
And you know what I love about this concept, which by the way, I'm hearing for the first time, like this is,
it's a cool one. Yeah.
This is like telehealth and real health mixed together because you have an actual doctor issuing it, but then you still have that doctor in the background that is backing everything up, making sure everything is valid. It's a cool concept.
That. Yeah, it's a very cool concept. Dr. Joseph Pizzona is the one that came up with it, and he's been doing this for the company's been open for 4 years now. We have some sites that are 3 years in, and I mean, it works really well for everyone. And it's, from a cost perspective for a hospital to deliver that same level of care through physicians, they'd be paying like 3 times what we charge. The whole concept's basically, NPs can do X, urologists can do Y, which is surgery and, high level consult. So we just try to silo those things into the proper channels and just make sure that everyone's using their time effectively. We don't want surgeons who are worth $300 to $500 an hour sitting there filling out charts or doing administrative work when you can have someone making $25, $30 an hour do that,
Yeah. And I've done quite a few interviews on this podcast. And one of my questions I typically do ask is, what's your thoughts on telehealth? Typically, if they have skin in the game, if they have some kind of position where they're like an owner of a telehealth company or they have shares in a telehealth company or whatever, they're an investor. Yeah, telehealth is the future. But if they're a doctor or someone who's just in the industry, they go, telehealth is fine, but it has its limitations.
Yeah,
it sounds like what you're doing. Yeah, has some.
Yeah. I mean, there's definitely limitations to telehealth, but we're not really providing. That's what's cool about our model, right? Is it's not telehealth where you have to have a physician available the whole time to sit there and interface with the patient. It's just really kind of triaging things for the urologist. So it's a different model. I mean, telehealth in general, I would agree with the doctor side of that. It's a great thing, and it can take care of a lot of issues and save people a lot of headaches from having to, take off work or commute or something to see a doctor for a basic issue. But there is something to be said for physical presence and being able to examine someone yourself and really kind of get, even on the primary care side, just kind of getting a feel for their overall health that could be more difficult remotely. But yeah,
I assume your founders are probably a urologist. Is that
he
correct?
is a urologist. Yep.
Have you ever thought about branching into other medicine? Do you think that's on the table?
That is on the table. Yeah, we're in pretty deep talks right now to pilot this in GI and ENT.
Hmm.
Now obviously there's a lot that would go into that, so it's not going to be anything too immediate, but by the end of next year, I would think that we'll have some gastro and ENT sites up and running as well. And we're just kind of trying to focus on the specialties where a bulk of the surgeries are kind of on the quick and simple side relative to, like a cardiothoracic surgery where you're cracking people's chests open doesn't really work here. In our doing emergency
Yeah.
surgery, this is a lot of stuff you can kind of schedule for a week or two later. It's not really going to be a big deal. And yeah.
I don't know if you can tell me this, but like you mentioned that there is a physician that can also go to the clinics if needed. Like who is this guy? Like who's going to all these rural clinics in
To do
America? Like
surgery?
it sounds like a
Yeah.
terrible job. Like I got a guy in Montana who needs surgery, and it's like gonna be, you're gonna have to fly into Bozeman. It's gonna be like a 4 hour drive, and you're gonna have to stay in like a motel, and it sounds pretty
Yeah.
crazy.
Yeah, well, luckily, most of our sites tend to be somewhat close to an urban center, and so we've been pretty fortunate to be able to keep it to where everyone's just driving in.
Hmm.
But the thing is, if you're a urologist or a surgeon, 90% of them, their favorite part of the job is operating. So it is attractive to some people if they can, maybe have someone else see their clinic patients that day and just go down and operate. And then the
Hmm.
compensation is very good as well.
Yeah, of course, and it's an adventure, right? Like I could see, traveling can be fun in a way.
Yeah, I like it. Yeah,
Yeah.
yeah.
Oh, it's awesome. Um, so in general, what's your sort of like picture of rural health? I remember my first exposure to rural health was I had a call with this dermatologist out of Louisiana, and he told me that his clinic was really struggling with hiring because he was in some small town. He was very interested in certain AI systems that he wanted to use at the clinic, and I had a follow up call. We were going to chat and get all this stuff set up. But not without getting into politics, basically, the U.S. government completely slashed him. Like he had some compensation, it was gone, and we just weren't able to move things forward.
Mm.
So, what's your take on this? Like, what is the state of rural healthcare in America, especially with some current
Yeah,
changes?
I mean overall, like obviously when you see the all the hospital closures, like that's a bad sign. Like obviously some adjustments probably need to be made. I'm not an expert in government policy. I dabbled in politics a little bit a long time ago and decided it's not for me. But yeah, I mean there definitely needs to be more support. I mean it seems like our current system is designed in favor of just kind of large health systems, large academic centers, and so the people that are often at those systems or at those academic centers, they've never lived in rural America. They've never practiced in rural America. They do not understand the challenges, which are real. I grew up in a place where I wouldn't call it rural, but there were a lot of cows, and it was 45 minutes to get to the hospital. And some of
Mhm.
these people are 2, 3 hours away, and then the local hospital closes, and now they're 4 hours away. I mean that's not a situation that I think a first world country should be facing. But at the same time, I'm not going to pretend like I know what the answer is. Some of these places definitely need more support. Using, and I kind of laugh when people call healthcare a free market, but this free market system is just not really delivering for a lot of these places. So I don't know if that's changes in reimbursement or what, but even the hospitals we do work with, even the more profitable rural hospitals, I mean, we're talking like airline profit margins. Like when we
Mm.
when we come in, some of these places we're giving them an extra $200,000 a year in gross profit to their bottom line, and
Yeah.
that is life changing for them. Even whereas $200,000 for like Mayo Clinic, like they wouldn't notice it. So
Yeah, of
um,
course, of course.
so
And
yeah,
it's
I
very
mean it.
similar with what we're doing here. Like by having AI in your administration, you can make everything more efficient. Um, I always call these clinics and I have these chats with them. Oh, we miss about 50% of our calls. They just go to voicemail. And it's like, well, that's 50% of your
Right?
patients are not going through. Like, don't you think that's a problem? And they think about it and they go, huh, that might be a problem now that I think about it. Um,
Yeah, they don't teach business in medical school. I'll just say that.
Exactly. And I know a guy who, you're putting it lightly, but I know our founder, Shukri Katan, he outright says it. He says, doctors are bad at business. And he says it and triggers some people, but there might be a bit
Yeah,
of
I mean,
truth to
look,
it.
obviously there are a lot of exceptions, but in general, I think they kind of have this thing where, they realize that they are smarter than pretty much everyone they meet and they're used to knowing everything. But when it comes to an area where they've never really had exposure or education, they think they can just figure it out. And a lot of times they can't. Like that's a great example. Like you're missing 50% of your potential patients. I mean, that's a lot of money going out the door. And I see stuff like that all the time though. It's crazy.
Yeah. I'll tell you an interesting little story. So one of the things we want to build is we want to build something for revenue cycle management. We want to build like an AI that can make your claims on your behalf and send them to whatever, Blue Cross Blue Shield, United, et cetera. It
Mhm.
knows what Blue Cross needs, it knows what United needs, and it will send it off. The goal is to have no claims get denied. Like this thing is so good at filing claims that your claims are now 100%. And I think one of the issues is with this is while we're building this and it's still not out yet, and then we have to convince clinics to use it, United's already building their AI, Blue Cross is building their AI. So I feel like healthcare is so behind, whereas the insurance companies are so ahead.
Yeah.
Um, and this is what worries me about the state of US healthcare is there needs to be more innovation. And I think that's what's going to save rural clinics as well. And I think your platform is a great use of that.
Yeah. No, I mean, I agree with all of that. I mean, I have noticed that within healthcare, things are very slow to change for whatever reason compared to like tech or, the insurance side of things. I know a lot of that's regulation. I know a lot of that's just standard bureaucracy that you get with, any large corporation or corporate entity. But yeah, I mean, it's very slow to change, and I wish I knew why. I don't know if it's cultural. I mean, there's also this kind of overhanging uh, grim reaper of risk and malpractice and all of that. So I think that has this effect to make everyone very risk averse, which then has the downstream effect of making everyone change averse. So if
Mhm.
there's a way to fix that culture, then that'd be great. But it seems very deeply ingrained for decades now to just avoid all risk, avoid all change, keep doing it the way you're doing it. Nobody's gonna get fired for continuing and doing it the way you're doing
Of
it.
course.
So
Everyone just wants to, hey, if life's easy, there's no reason to change. Yeah.
yeah,
Another thing, I don't know if you're aware, but there's a lot of clinics are getting bought by private equity. Um,
yeah, very big in urology.
oh,
Um,
really?
yeah, like there's this one very large group based out of Maryland that just they keep merging and buying new things. I mean, they have hundreds of doctors employed at this point, so it's a very big issue that we see. So I mean, what's basically happening is we're moving away from physician ownership in healthcare, and this is an intentional thing done by Washington. I mean, physicians are not allowed to own hospitals. There's all these crazy restrictions on what they can do, and so that you end up with a system that's, someone's going to come in and scoop up that money and that profit, and obviously with the state of the American economy, it's going to be private equity firms. So, um,
Yeah.
I will say there are some very good private equity firms out there that know what they're doing, even within healthcare, but that's not most of them. A lot of them, they're just seeing numbers on a page. They see a profit opportunity. They don't understand healthcare, nor do they really care about, let's say, patient outcomes or anything, unless you're leaving them a Google review. I don't think they really care about your outcome, let alone the physicians and the fact that now, rather than working hard for however long to get partnership in a group that's worth something, now you're just an employee. You're just a cog in a wheel like everybody else. So, you know, I,
Yeah.
if you look at all the physician burnout stuff, which I almost cringe when I hear physician burnout now because I know everybody gets burned out, but to me, you get burned out when you lose autonomy, and that's what's happened to physicians very rapidly over the last couple of decades. They used to all, not all, but it used to be even 20 years ago, 15% maybe were employed, the rest were in private practice, and now it's the complete opposite. And with the way
Yeah.
that like Medicare reimbursements and such are set up, it just doesn't really make sense to have a private group these days. Financially, it's just easier to have the hospital bill everything and work within their ecosystem.
Yeah, exactly. It's easier just to be a part of an MSO, a hospital, private equity group, and then just call it a day.
Yeah,
Definitely.
yeah.
So, what's kind of the golden future that your company can offer clinics? Like, what is the best outcome, would you say?
Yeah, I mean, it's, as simple as just, delivering urology care to a community that otherwise would never have it. Hiring a full-timer is not really an option for these hospitals. There's a huge shortage, and 90% of the new grads want to be in major cities. So if you're, a part of a big group, well, we're just really giving hospitals an option to supply those services that otherwise wouldn't exist. And then, and everyone, and the part of our conversation with hospitals, helping them understand that, when you don't have urology, you're not just losing urology patients. You're losing patients. If you send a patient down the road for care, they might stay there forever. That might be who they, that might be the system they go to for everything. So it's about, in this very competitive environment with these razor thin margins, if you as a rural hospital can just add one or two more specialty service lines, I mean, that could make you then profitable to where you can then keep expanding and hiring and growing. So there's some hospital leaders that I feel like are extremely risk averse and just they don't want to spend any money, but at the same time, like you can't just wave a magic wand and make urology services appear. People have to be compensated a lot of money to provide that care. So, yeah, I mean, that's kind of my overall thoughts on it.
Hmm. And are you implementing AI at all in any operations?
I mean, we use it for, honestly, we use GPT, and I've built a few custom GPTs just for kind of clerical tasks, copywriting, helping with like analyzing schedules and that sort of thing. But um, on the clinical side, we don't really have any AI tools or anything that we use. I'm sure a couple of our hospital partners do, and we'll always kind of work within their tech stack. But no, I just I would. I'm always kind of trying to explore the new AI products out there because I know it's there's constantly new stuff coming, and for what we do, I think you kind of do need some there are some highly specialized tools that will eventually exist that we can use, but so far, I think we're just using AI like every other company out there.
Yeah. In theory, if I was a nurse practitioner and I was partnered with you and I had, decent gastro, decent urology experience, like what would stop me from just hooking up to your platform and just dealing with the doctors, and then everything is just done to the doctors, and I'm just the front person who does all of the patient communication and processes.
Yeah, no, I mean we do have some sites where they will have an experienced APP come in, and that makes our job a lot easier. And then yeah, we can just plug them right into our system, and we still have to figure out the surgical side, like what's the surgical volume and how many days per month that we need to accomplish that, and what's their OR availability, et cetera. But yeah, I love when we find someone when one of our clients hires someone that already has that experience, but it's probably only 20-ish% of them so far.
But what I'm alluding to is this could be like the actual future of healthcare, potentially.
I have heard that. I've had some hospital CEOs say that to me. So I agree. I'm very
Yeah.
excited to be here. And it's just at this point we're just trying to keep up with the growth, man. Yeah, no,
Well,
it's
we'll leave it
great.
at that. Thank you so much, Nick.
Yeah,
I appreciate it.
okay. Yeah, you too.